helpers and those that are serving others, we're often giving and giving and giving of ourselves. How often do we take time to pour into ourselves? Have you been feeling stressed out, overwhelmed, maybe feeling a bit of compassion fatigue? This training will help you kind of recognize some of the symptoms that you may be having and really focus on what are some of those skills of resiliency that you can help to build to make you successful so that you can be your best self as you give to others. Get started. Good morning. My name is Amy McCain. I'm the Director of Prevention at Red Oak Behavioral Health. I've been with Red Oak for about 2.5 years now. I am a licensed social worker. I am also a certified prevention consultant. I have been doing prevention, treatment, counseling, the whole gamut of behavioral health and social services for over 25 years now. And so one of the things that I really enjoy is being able to have opportunities like this, where I'm able to come, talk, share information, learn from, people that are still doing things in the field as well, or doing different things in the field. So I always love for opportunities like this, where we're able just to take a moment to learn, remember a few things that we probably already know, because I doubt I'm going to teach you anything new today. But it's good for us to remind ourselves about important things. And this topic today, secondary traumatic stress and resilience. This is when Anne at our agency just put together a whole list of different topics we could cover. This is one that, your organization chose. Like, we definitely want to talk about this because it is so important, right? And even as I was preparing the presentation and preparing the slides, I was doing some self-work on myself at the same time. Like, okay, Amy, you need to pay attention to some of these things too. But how often is that true, right? Those that are in the helping profession who are giving, how often do we take time to make sure we're taking care of ourselves as well too? So I'm going to talk a little bit about that today, but I want to start off with allowing you all to introduce yourself to me and tell me kind of what is the work that you do here for Grace House. And we'll start here. And we'll pass the microphone.
My name is Tess. I am one of the social workers with Summa Hospice. I'm a little bit newer to the company, so, but I'll be at this facility as well.
Okay. Yeah. Well, thank you.
So I am Angie Alonso. I am also a social worker with Summa Hospice. I actually work on the inpatient side of hospice there at Akron City Hospital. So a lot of times I'm the one referring out to Grace House for our individuals in need.
Okay. Go.
I'm Ginger. I'm also a social worker from Summa
Hey,
Hospice.
I'm with my people up here. Okay.
And I'm, in the community in the Akron area.
Okay. Thank you.
Hi, I'm Sandy, and I'm a volunteer here.
All right. Thank you, Sandy.
I'm Holly. I'm the executive director of Grace House.
I'm Amanda, development here at Grace House.
Okay.
I'm Sarah, and I'm marketing coordinator at Grace House.
Okay. Holly's like, I'm just the executive director.
Never just anything.
Just. Okay. Quickly go over some of our training objectives for today. We're going to develop an understanding of secondary traumatic stress, compassion fatigue, and burnout, and the associated symptoms. Really differentiate between secondary traumatic stress, compassion fatigue, and burnout. We're going to discuss the importance of resilience, and I should have said resiliency, and review ways to build resilience. But let me learn from you this morning. What moved you to take this training, or what is it that you want to gain or learn from this presentation? Did you just show up just to show up, or?
Not all at once, right?
Okay.
I'll be the first. I'll be the guinea pig. So for me, I'm always in the thought process that we should always be in constant learning. So though I'm well aware of the subject matter, sometimes it's always nice to see someone else's take on it and try to continue to learn and grow.
Okay. Now she put a little pressure on me right there. She said, "I'm well aware of the thoughts." So,
I approached Red Oak about this training and these training modules because the population we deal with is so complicated. And, I've worked in hospice now for 16 years, and just the churn and seeing healthcare professionals take on the stress and grief and trauma of others, especially since the pandemic. I think we need to do a better job taking care of ourselves and each other.
Right.
So that was partially why I was like, this will be perfect.
Well, I'm really happy to be here because besides the grief that we have when we lose someone, you can't help but get attached to some of these folks. They're just so adorable. But also in our own lives, because I was helping a friend of mine caregive for her mom. And with my hospice background, I had said to her, "Had you told your mom it's okay to go?" She said, "Oh, no, I had no idea." Well, lo and behold, she told her, and she then died. So it's like I kind of lost this relationship with this family member. So it's like I was dealing with my own grief. It's so strange how that all came about. So I'm really grateful to be here today.
Because even though we're helping others in their grief, we grieve as well, right? So the job that we do doesn't stop our own lives from going on and the things that we deal with. And one of the points Holly brought up in thinking back on the pandemic, right? What was so different during the pandemic was for those of us that are in the helping professions that was trying to help everybody, but we were struggling ourselves, dealing with everything else that was going on. It wasn't like you could step away from it. You were surrounded by it at all times. And so I think that just made it even more important, more relevant for us to remind ourselves as professionals what we need to do to take care of ourselves, what we need to pay attention to as well. So this is about an hour-long presentation. So we're not going to go in depth in a lot of things, but I'm going to share information, but open to communication, to discussion. If you have a question or a comment or a thought about something, please, jump in and let's just learn from each other today. All right. So let's start out with burnout, right? So when we're talking about secondary traumatic stress and compassion fatigue and burnout, some of the things like what is it? Which one is it? What are we doing, right? So let's start out just with a basic understanding of burnout. So burnout really is that chronic condition caused by excessive exposure to stress that creates physical, mental, and emotional exhaustion. So we have that excessive stress. We feel exhausted, right? Physically, mentally, emotionally, we feel like our resources are depleted. We feel overwhelmed by the demands that we have to face. And that cycle just continues, right? I feel overwhelmed, yet I don't feel like I have all the resources I need, whether they're internal resources or external resources, right? Sometimes I just don't have the internal resources. I'm tired, I'm exhausted, I don't have what I need to really function and continue on in everything that I'm doing. And it just continues to lead to our stress and all of those things. Burnout doesn't happen overnight, right? We don't just wake up one day and say, whew, I'm burnt out. Now, some of these kids do, right? So my granddaughter is staying, if she's 14 and she's staying like how quickly they get burnt out from anything, right? It's like, oh, wait a minute, come on, you haven't even dealt with that long. Like, no, I'm done with it, Grandma. I don't want to do it anymore. I'm like, okay. But generally, burnout takes time, right? It's a continual process of feeling overwhelmed, feeling like your resources aren't enough, excessive stress, all of those things. It generally doesn't happen overnight. So it's important for us to pay attention to what we're feeling or what we're noticing, what we're experiencing, right? So when do you know that you're starting to feel burnt out, right? What are some of the things that, on a car, when the gas is running empty, that red light starts flashing. My husband complains at me because I've been known to ignore the red light thinking I'm going to find a gas station with the grass just a little cheaper. It never really happens. And I end up paying more than if I would have stopped when the light came on. But how many times do we ignore that flashing red light that we're running on empty, right? So take a moment and just think personally, what are some of the things that your body tells you that allows you to know when you're running on empty? What are some of the things that warn you that, oh my gosh, I've just been ignoring that. I've been ignoring that, right? Pay attention to those things because those are important. Some of the symptoms, as we said. So when you think about some of those things I just asked you to call to memory, physical symptoms, right? So exhaustion, tension. Many times I'm sitting at home, I'm like, my neck, oh my gosh, my neck, just feeling the tension in my neck. Even after a stressful day, lack of energy, like I can't do anything. I'm just sitting here comatose in my chair after work, about to fall out because I'm just that tired. Some of those are very common physical manifestations, and it really indicates a body under significant stress, right? So really paying attention when your body is physically telling you you're exhausted, you're tired. Pay attention to those things. Mental symptoms, right? You ever find yourself just sitting there like, I can't focus on anything right now. I have so many worries in my head, I can't focus on one, right? So that reduced concentration, disinterest in previously enjoyable tasks. You want me to go where? I don't have the energy to do anything. No, I don't want to go, shopping with you today. Any of those things. Those things can reflect a decline both in our cognitive and our motivational engagement. So pay attention to those things. And emotional stuff. How irritable are we, right? I often tell, my team, like, if it's around grant writing time or something comes like, let me forewarn you. If I'm a little snappy, it's just because there are a lot of demands right now. Or if I say, handle that on your own because I have to focus on this. Those times when we find ourselves a little more irritable, resentment towards colleagues, clients may arise, right? So really paying attention to those because these feelings both signify emotional strain, and we can start to feel detached from those we're there to serve, those we're working with. So we really want to pay attention to those things. So if you're like, oh my gosh, I'm feeling all of those things all of the time, right? How do we start, really paying attention to how's Amy doing right now, right? While Amy is focusing on everybody else, how's Amy doing? Because if Amy's not okay, Amy's not going to be as effective as she can with everybody else, right? So that's burnout. When we talk about secondary traumatic stress, it really refers to the emotional distress that a person may experience after indirect exposure to a traumatic event. This can include exposure to crimes, accidents, forms of abuse, death, grief, all of those things, right? So those who are in the helping profession, those who are in the roles where they're serving or helping others, we deal with this all the time, right? Whether it's hearing someone's traumatic story, whether it's being there with them as they're going through the grief process, whether it's being with someone as they're going through the end of life process, all of those things are secondary trauma that we're experiencing through witnessing through someone else. Other examples of how people, when we think about the helping profession, sometimes we just think about those that are working directly with clients or with patients, but what about the person who has to review notes, who's reading a traumatic story? Even that can have an impact on you as well. So paying attention to those things. In our role, we're really exposed to a lot of trauma, a lot of hurt, a lot of pain, and we take it all in, but how do we deal with it? How do we process it? And so when we're looking at secondary traumatic stress, we're really looking at a form of PTSD, really, gaining and showing I got some post-traumatic stress going on myself just from dealing with witnessing and being a part of someone else's trauma. Secondary traumatic stress is often referred to as compassion fatigue or vicarious trauma. Those may be some terms that some of us hear a little bit more. When we're looking at compassion fatigue, it really is that emotional and physical erosion. I like that word, erosion, right? Because when we talk about erosion, something doesn't erode overnight. It takes time. And so when we look at compassion fatigue, it's the dwindling and eroding of our compassion for others based on just that we've been overwhelmed by so much trauma as well too. And it really takes place when helpers are unable to refuel or regenerate, right? So when we keep ignoring that flashing red gas light, refuel, 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 the longer we ignore it, eventually the car is going to stop, right? And so when we're starting to talk about secondary traumatic stress, compassion fatigue, our car is putting. It's trying to keep going, but it's not going very fast, and it's not getting us very far because we really have depleted our resources. Vicarious trauma was coined by Perlman and Sack-Fitney. I probably mispronounced that, but and it really was to describe the profound shift in the worldview that occurs in helping professionals when they work with clients who have experienced trauma. So not only does it impact our ability to, to have compassion, but it begins to impact our worldview, right? We begin to look at things differently, right? So we may begin to feel more doom and gloom, where before we were more positivity and encouragement, right? And it can begin to have an impact on how we view the world as well too. What's the difference, right? So we talked about secondary traumatic stress, vicarious trauma. So those terms generally are used interchangeably to describe the sense of hurt or upset that comes to those who are close to the victim of trauma, such as a family member or a helping professional. And compassion fatigue is also sometimes used. But when we talk about burnout describes the physical and emotional exhaustion that workers can experience when they have low job satisfaction, feel powerless, and overwhelmed at work. Burnout, however, does not necessarily mean that we have lost the ability to have compassion for others. So do we see the difference between the two? So anybody can have burnout, whether they're in a helping profession or not. They can just be burnt out from the everyday work that they're doing, the job that they're doing, everything that's going on. But when we combine trauma, dealing with trauma, the stress of that, compassion fatigue, burnout, all of those things. So where there's a difference between them, the key difference really in secondary trauma, traumatic stress, and compassion fatigue is that impact on our ability to have compassion for others, the impact on our worldview. Again, for those in helping professions, this is an occupational hazard. Right? So people that work in factories and they have to put on those steel-toed boots, right? Because an occupational hazard is something might fall and break their toe or their foot. So they have to be prepared for that. Knowing and starting out and knowing that, hey, this compassion fatigue, vicarious trauma, all of these things are an occupational hazard of me doing my job. Shouldn't we be preparing us some steel-toed boots to help preventatively, knowing that this is an occupational hazard? But how many times do we forget to do those things? You don't have to raise your hand. It's okay. It's okay. No judgment here. As I told you, as I was going through this, I was doing some little self-assessment on myself too. Like, okay, Amy, what's going on? And again, they describe it as our strong reactions to grief, rage, outrage. It's our numbing right? Our protective shell. I just can't hear anymore. I can't hear any more trauma. I can't lose another person. It just hurts too bad, right? And at some point it begins to be our protective shell and our wish not to know. Like you just want to put your la 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 la, and the kids are calling your name over and over and over again. Don't ask me for nothing else, right? You just want to put your fingers in your ears, say I don't want to hear anything else. And it may be the result of repeated exposure to secondary trauma or from one event. Right? So when we talk about burnout, that generally is that erosion over time. But when we talk about secondary traumatic events, this may be from a one-time event. So a friend of mine, we started out in social work together. And she was working with a client that got killed. And it impacted her so much that she left the field. She's a beautiful hairstylist now. So she decided, I don't want to do this anymore. I'm going to do hair, right? So she's a beautiful hairstylist. But that one event caused her so much secondary trauma that she decided, I can't do it. So sometimes we believe like, oh, it's just the repeated over and over and over again. But sometimes it's one instance that really can knock us off our feet, right? That care, love we may have for someone that we've gotten close to, and we spent time with. And even though we know we work at a hospice facility, so we know, kind of the type of work that we're in, that does not mean it doesn't make it difficult when someone leaves and we have to deal with that grief. And so it may be a one-time incident, or it may be that repeated exposure to trauma. How are we feeling? Okay, some ding ding dings popping off in my head? Like, okay, I need to start paying attention to that red light, right? And so when we start looking at some of those symptoms of secondary traumatic stress, right? So if we've ignored our burnout symptoms, maybe we need to pay attention to some of these emotional symptoms: sadness, anger, guilt, right? I could have done more. I could have saved that person. I could have been more. We begin to feel guilt that doesn't belong to us at all. Numbness, right? I'm hearing the same type of trauma over and over that I've become numb to it. And oftentimes we can feel helpless as well too. There's nothing I can do. Same things are just going to I keep doing all of these things. I'm not being effective. Nothing is helping. The same stuff starts helping, right? Cognitive symptoms: apathy, difficulty concentrating. We start to begin to have that rigid thinking, right? Well, if they don't want to listen to me, I told them what to do. Shame on them. Oh, the social workers are up here laughing, right? How many times have we gotten to that point, right? How many times am I going to tell them what they need to do and they do the exact opposite? We get into that rigid thinking, kind of that preoccupation with trauma. So even when we're not dealing with trauma, we're thinking about trauma, we're anticipating and expecting even more trauma. Why? Because we've gone through this cycle over and over again. And so we're, preoccupied with it. Feeling of perfectionism, maybe if I just do this perfectly, if I do it this way this time, things will turn out differently. I'll have a better impact. All of those things. Behaviorally, right? Sleep problems. And that can be lack of sleep or oversleeping, right? How many of, my helping professional friends are like, I just find myself waking up at 2:00 in the morning every day. I just did that. Right. I couldn't go back to sleep. I did, I'm waking up every night. Or as soon as I get home, I just crashed for the whole evening. I needed to do this for my family, or I needed to do that, but all I could do was sleep, right? So those sleep problems, withdrawal, when you start feeling like, I just don't even want to be around anybody, right? I don't want to hear anything. I don't want to talk to anybody. I just want to be by myself. Now, I am an introvert, so I do need my self-time, right? But we're not talking about, kind of that self-time. We're really talking about pulling away from people that generally you want to be around, that you spend time, who feed into you, and you're finding, I don't want to be around anybody. Changes in appetite, hypervigilant, that elevated startle response, right? Someone comes into your office and say, hi, what's your name?
Angie.
Hi, Angie. What do you want now, right? What do you need me to do now, right? So that elevated startle response. And true story, I think I had this response yesterday in a team meeting where my supervisor says, oh, and I'm like, what do I need to do now? I'm trying to finish a presentation. But that elevated startle response. And our physical symptoms, right? We can feel it. As I said before, difficulty breathing, breath is essential to life, right? And so when we even talk about, teaching people how to breathe, we're teaching them how to really focus on the core of living. Without breath, we're not here, right? So when we remind people, slow down, take some breaths. But how often we're so rushed, we're not doing that ourselves. Muscle aches and joint pain. I'm almost to the point where, which is so bad. So when we're talking about, I'm going to use myself as an example, right? I had signed up for a monthly membership to go and get a massage once a month. Guess what happened? I paid every month for a massage. Guess how often I went? So what did I find myself doing? Giving these massages that I'm paying for every month to other people. Like I'm gifting them to other people. Again, giving to everybody else. Wait a minute, Amy, that was something that you were supposed to be doing for your own self-care. As I'm sitting there like, oh, my neck hurt, my back hurt, I'm so stiff, right? How many times do we do that? Pay attention to those physical symptoms. Impaired immune system, right? How many times do when we're stressed, we get sick? Or we get sick and it hits us the worst, right? Because we're stressed at the same time. Our immune system is down. Increased heart rate, increased severity of medical concerns as well too. Do we need to start paying attention to that blinking red light? Did you check some of those things off the list like, oh, wait a minute. When we talk about compassion fatigue, it really is the toll of compassion, right? It's kind of what we're paying out in having compassion for others. And again, we'll see that emotional exhaustion, physical exhaustion, mental exhaustion, secondary traumatic stress, our decreased empathy, right? And it's so hard to do your job when you're serving others and you have decreased empathy, right? And detachment, right? Detachment from work, personal relationships, those we're serving. If I just, detach myself from people, just show up, do what I'm expected to do, and keep my attachment to myself, maybe I can protect myself. So, which is it? This is a question you ask yourself. Is it secondary traumatic stress or compassion fatigue, vicarious trauma, or is it burnout, right? And so really asking yourself, what makes my job challenging? Is it the client situations? Is it the trauma that I'm dealing with, from the client situations? Is it the grief, the trauma, the loss? Is all those things really what's impacting me or overwhelming me? Or is it my workload? Is it I got too many clients? I had too many notes to do. There are too many things that I have to do. I just don't have enough time to get it, all done. I don't feel like people support me as I'm doing the job. I'm sure that doesn't, happen here because this is a wonderful organization. But realistically, sometimes we feel like we're out here doing it on our own, right? And so how are we connecting? Are we making sure we're getting adequate supervision? Are we checking in with our peer or colleagues? What are those things that are really adding to that? So asking yourself, is it one or the other? Or is it both? Is it all of the above? In the reality, in the work that we do, it's often all of the above, right? So it's often a combination of factors that I may be feeling burnt out because, oh my gosh, here's another patient, another client I have to see, someone else I have to see, more work that I have to do. And at the same time, you may be, overwhelmed by the trauma, the grief, the impact of those things as well too, right? Why it's important to know which one it is because you deal with it differently, right? So if it's I should never say just. If it's only burnout, and you're handling kind of the trauma of things okay, or you felt, you really have found a way for you to take care of yourself and deal with the traumatic side of the work that you do okay, but you're really finding like just time-wise, like I can't, between the notes, between running around seeing this person, just the time, I don't have enough, then okay, what are some of the things that I can change in that situation? How do I, look at, maybe some better time management? How do I find ways where I'm able to get these things done where I'm not stressed or feeling overworked? How do I, let my supervisor know, hey, I'm up to 75 people. I don't put anybody else on my caseload, right? So how do you have those conversations? Whereas when we talk about secondary traumatic stress, we just said it's a form of PTSD, right? So we need to do a little bit more than maybe just adjust a few things. We really do need to look at both self-care, sometimes professional help if it's needed, and being okay with asking that, and really looking at how do we hone in on some of our inherent resiliency and ways to be, kind of more resilient. Just as it takes time, that erosion process takes time. It also takes time to kind of get back in a better place, in a place where you're functioning better as well too. And I say it's an ongoing process. So it's not, it's not like, okay, I took my medicine, now I feel better, so I don't need to take my medicine anymore. Some medicines, that's the case, right? But I have someone who has high blood pressure. And it's like, well, I took my medicine and my blood pressure got better, so I stopped taking my medicine. Oh, okay. And what happened? Well, my blood pressure got worse. I'm like, okay. But basically when we talk about, it's an ongoing process, especially if we know, we said before, this is a toll, this is a occupational hazard, right? Of the work that we do. Is that hazard going to go away? No. That hazard is always going to remain there. What's going to be different is how we prepare for it. And how do we make sure we're being really intentional on how we deal with it? Because if we don't even think about it,
It'll make an appointment for you. That's what I say. If you don't deal with it yourself, it'll make an appointment for you.
Okay, see, there she goes. See, she said, I told you what to do. You didn't do it. So But realistically, right? I mean, that's, not just ignoring the flashing red light, but pretending like it's not even flashing. Being totally blind to it. Oftentimes, that's how we're functioning. Right? And so this is how we can prepare for it. We can prep for it. If I know, okay, I have about 60 miles before I, hit empty. And I know that the gas station that I love to go where I get the best price, I can plan to make sure I get to that gas station in enough time before I hit empty, right? So if wait a minute, this time of year is always more stressful. For whatever reason, right? And we can't remove ourselves from the equation. So all of the work stuff that we're doing is one thing, but guess what? Life keeps lifing, right? So our personal stuff is still going on as well too. So if you know, okay, wait, I got all this stuff in my personal life going on and this stuff at work, it's going to get really stressful. So if I know that beforehand, I can be able to pre-plan to say, what are some things that I can do that I don't become too overwhelmed? Don't worry. I know we don't do it. I don't do it either. But this is why we're having these conversations, right? And then also, when we talk about compassion fatigue, we really want to look at how can we start dealing with that, right? Kind of that road to being okay. First off, we have to recognize it. We have to acknowledge it. We have to say, I'm tired, right? This is what I'm feeling. I don't want to hear about any more trauma. I don't want to lose anyone else. I don't want to get close to somebody else just for them to go, right? We have to recognize compassion fatigue. We have to identify what are those symptoms that I'm experiencing. What are those things that I'm feeling? We have to recognize it. So we can't keep closing our eyes to that blinking red light. Then we can implement some short-term solutions. Sometimes, now short-term solutions aren't the answer to the problem, but sometimes they're what we need, right? Sometimes we need a PTO day, right? Sometimes it's just gotten so bad, I need a day, right? Or, a holiday, or as I said before, a massage that I gave to everyone else. But sometimes those quick fixes to help us relax in that moment, because if we're always in a hypervigilant state, if we're always in a stressful state, sometimes we really need those quick fixes just to help us calm down, whether it's in the moment, whether it's taking a day. And then we need to really look at how do we develop our resiliency skills. This really helps us build long-term stress management techniques. It helps us not only deal with what we're currently dealing with, but also prepare for what's to come, right? Because we said this hazard isn't going away. So then how do we learn to be prepared for that? And so that's why we're going to talk today about resiliency skills. Prioritize health and wellness. So make personal well-being a top priority, right? So all of the things that we preach to everyone else, we need to start doing those things ourselves as well. How do I make my personal health a top priority? And the next month, I'll be back again, and we're talking about self-care, and we're talking about some of those things. So we'll get more into that next month. We're going to focus the rest of today on resiliency, and then finally achieve full resource recovery. And I like they said, it's a resource recovery, right? Because it's not like, oh, I'm fine, I'm perfect, I'm done, right? No, it helps us really understand and restore both our emotional and mental resources, because by building back up those resources, what are we doing? We're preparing ourselves to deal with the next thing to come, right? We were allowed to say, oh, just everything is, rosy, and we never experience any problems, no trauma. But that's not life, right? So we're really looking at how do we restore our resources, both internal and external resources, to deal with the occupational hazard of compassion and compassion fatigue. So we're going to talk a little bit about resiliency, but before we do that, oftentimes one thing is important. So we talk about compassion fatigue, but there's also a thing of compassion satisfaction, right? Can someone share with me why you do what you do? Why you work for an organization that helps people in their end of life process? Anyone want to share? No one wants to share.
Back in about 2004, when my one aunt was passing away, they had hospice in. And my mom and my other aunt had said, oh, you would make a wonderful hospice social worker. Well, many years went by, and when my mom was dying, I'm like, you know what, this is what I need to do. So about 2 months after she passed, I went into hospice, and that was my true calling. So,
Okay.
yeah.
Thank you
my
for
story.
sharing. Anyone else? Okay. See, once one person gets started, that's
I know I had to find my words. So I got into social work to deal with emotional stuff, right? All the stuff. Grief, not just in death, but grieving every day, grieving people that we haven't lost, handling the emotions. Why do we do the things that we do? Why do we think the way that we think? So I was a mental health counselor for about 7 years. And then my dad passed away recently, well, 2-3 years ago, on hospice care. And that kind of pivoted me wanting to do this even more than previously. So grief in everyday life, emotions in everyday life. I was fortunate at the time, before my dad passed, to not have experienced anything traumatic, quote unquote. But I wanted to help people that have, because you know somebody that has. And then to experience it myself was totally different ballgame. And it gives you a different lens to look out of, a different empathetic ear. So then connecting with the right people, you have to have the heart for it. And like I said, connecting with the right people, knowing the right people to kind of guide you to help others.
All right. Thank you. Thank you for sharing.
Sorry.
Anyone else? Okay. But in doing that, when we're feeling that compassion fatigue, sometimes it's important to remind ourselves of our why. Why is it that I'm doing this? Because I didn't hear anyone say, I'm doing this because I make such great money and I want to be rich and have, complete job satisfaction with no stress. None of us are doing it for that reason, right? Generally, we're in this field, we're in the helping profession because we want to help. Right? And so sometimes we have to remind ourselves of our why, because there is some satisfaction in compassion as well too, right? So just as there is compassion fatigue, there is also compassion satisfaction. And how do we build that, right? So if you enjoy helping people, right? If you're feeling some of that compassion fatigue, get back to those pieces and parts that you really enjoy doing. How can I, help someone and really find that joy that's derived from assisting others? Feeling part of something bigger, right? So if you really got into this type of work because I want to have a greater impact, I want to feel like I'm part of something bigger, I belong to something bigger. What are we doing to making sure that we're really working on and being intentional about feeding that need for why we signed up for this? Maybe it's your faith that drove you to this type of work, right? So how am I getting spiritual purpose and commitment and contentment out of it? Maybe it's because I just want to help those in need, right? And I want to, really support vulnerable people. So if that's the case, what are some things that I'm doing on the advocacy end that can help me build and feed that need as well too? And so I just like to, I like to see everybody win, right? So sometimes we just want to see positive changes, right? And it's difficult when you're telling them and they're not listening, right? And they're not doing what they're supposed to do, right? But sometimes that's why it's important to celebrate the wins, right? Because when you deal with so much, and to make the wins, don't make them so large, right? Celebrate every little milestone, because that helps feed and remind us of why we're doing the work that we're doing, right? So not just, we hear compassion fatigue all the time. We need to start saying compassion satisfaction too, because we do get something from the work that we do. So resiliency. So it refers to a person's capacity to handle stress, high demands, and pressure, both internal and external stressors. So if we're honest, a lot of things we talk about are external stressors, but there are a lot of internal stuff, right? A lot of stuff that we deal with ourselves that can increase our stress level as well too. And so resiliency really looks at how I'm able to deal with all of those stressors. It's the ability to be resourceful and flexible as a means to adapt to difficult situations. It's that bounce back, that bend and not break. And I put up there, a picture of Aesop's fable, the oak and the reed. Has anybody read that fable before? So basically, without, just reading it to you, I'll just give you my version of it. So you have this big oak tree, and then you have the little reeds that's down there by the oak tree. And as the storms come, the oak trees say, "Look at you, old little reed, you're always bending and you sing this mournful song, but I stand tall and proud." And the reeds were like, "Just wait. You're okay right now, but there's a storm coming. And let's see what's going to happen," right? So this big storm comes and the oak, big oak tree is standing strong and proud, and I'm not going to bend. I can take it. And what happens to the oak tree? It breaks, right? It breaks. And the reeds who've learned to sway with the storm, to bend when they need to and bounce back up, they survive, right? So when we talk about resiliency, what was the same for both the reed and the oak tree? What was the same in that story?
Stressor.
They all experienced the same storm, right? It didn't say it was a different storm for the tree, and they experienced the same storms. Yet their response to it determined whether or not they broke or whether or not they bounced back. So when we talk about resiliency, we're talking about our ability to bounce back, because we're all going to face those occupational hazards, right? So how have we looked at our ability to bounce back? One of the most important factor in resiliency is having caring and supporting relationships. The most important factor in resiliency is having caring and supporting relationships. I'm going to say it one more time. The most important factor in resiliency is having caring and supportive relationships. Why is that important? Because too often times when we're feeling stressed out, what do? We withdraw. We remove ourselves from the one thing that's actually going to help us get through. We remove ourselves from the relationships and the situations that's going to help us to bend and not break. But we need to determine what those are beforehand, right? Because there are some relationships that help us break. We recognize that, right? So we know that there's some people in our lives like, that's not my storm survivor. That's not who I'm going to when I'm a storm, because they're not going, help me out. So really looking at and knowing, who is my support system? Who can I depend on? Who can I talk to when I'm having a bad day and I just need to vent for a minute? Who are those people? Who are those people that are going to hold me accountable, right? Who's going to say, "I hear you saying all those things, but Amy, what have you done to take care of yourself?" Right? So we need those people in our lives that love and trust, right? When we think about the importance of love and trust, right? How are we building on that? Making sure that we have those role models. So being intentional about knowing who's somebody in my field that has done this, mentors are so important, right? So having someone that you can talk to, because there are people in my family that I can talk to about stuff, but they just don't understand work stuff, and so sometimes I'll talk to my husband. I'm like, that was just a wasted conversation. I need to call, my work friend, because she's going to understand what I'm saying, right? I'm spending too much time explaining to you everything. So exactly, having a mentor, having role models, people who have been successful in dealing with the storms, right? Having those. Encouragement. Oftentimes we need someone to encourage us, to give us that motivation that, Yes, it's hard, but you can do it. Just giving us that in additional motivation. When we think about those things that we often are to other people, isn't it important for us to have someone that's doing that for us as well too? So other factors in resilience, the ability to make realistic plans and take action steps to carry them out. Sometimes we don't make realistic plans, right? We just, I gotta do. Sometimes we need to really take a step back and make some realistic plans about how I can make this situation, how I can do my job in such a way where I'm not feeling so burnt out or so stressed out. Having a positive view of yourself and a realistic but confident understanding of your strengths and abilities, right? Nothing is more stressful than trying to do something that you're not good at, or that you haven't learned to do well or practice to do well. And that's often what I tell people who are new to the field of social work, who are new to the field, they come in and I want to save the world, right? I want to do all of these things. And then when one thing comes up, they're knocked off of their feet, right? Take the time to recognize your strengths and ability and to build upon those strengths and abilities. Positive communication and problem solving. What's something that we do all of the time? When we're stressed out, we're dealing with a problem at work. Do we communicate? Do we share with other people? Do we say, this is what's going on? Oftentimes we keep it to ourselves. Or we communicate it negatively, right? We wait till it's a problem and we're just, saying things in a negative way. Really that positive communication and problem solving. The ability to manage strong feelings and impulses in a healthy way. There are going to be times when we have strong feelings, right? How am I dealing with that? Have I developed my own calm down techniques, right? We do a lot of work with young people and we sit and we help them make calm down, jars and all of those things. And how many times do we do those things for ourselves? I got this little sloth. I love sloths. They're my spirit animal. But I got this little sloth I keep on my desk, and it's a scrunchy sloth, and I just squeeze it all up. Poor thing, it's all out of shape. But little things like that. What are we doing to be intentional about? How do I handle my strong feelings, strong impulses? Feeling a little stressed out, feeling a little overwhelmed. I'll sit here with my little spirit animal for a little while. Be intentional about knowing what some of those things are so that you're able to really deal with those impulses in a healthy way. Be psychologically flexible, right? And so we got to get away from that rigid thinking. We got to get away from everything's black and white. Everything has to be one way or the other. This one right here. Maintaining balance in life. Knowing when to rely on others and when to rely on yourself. Challenging yourself to take action when needed and knowing when you need to rest and recover. There are times when we definitely need to do more. And there are times when we need to do less. Knowing when those times are, being able to have that balance is important. There are times when we really need the help of other people. And there are times when we have to rely on our resources to get through a situation. And there are times when we need both. But knowing and maintaining that balance is so important. But it's also one of the most difficult things to do, right? So some ways to build resilience. Build strong connections with others. As we started out, one of the most important things is relationship, right? Caring and loving relationships. We have to make sure we clarify. But how to build strong connections with others. If you find that you don't have a support system, you need to work on building a support system, right? Be sure to allow others to help you. And that's it. I told you I would use myself as an example. That's the biggest thing for me. I oftentimes, even when I share with someone and they offer to help, my response often is, don't worry, I got it, right? I still can do it, right? I laugh. My husband talks about me all the time because I'll say, you know, honey, can you? And if he doesn't do it right then, I'm like, don't worry about it. I got it. I can do it. It's like, I was just about to do it if you calm down for a minute. But how many times do we do that, right? If we, you know, or if we share with somebody and they don't volunteer to help, we're like, it's all right, I'll do it myself. We didn't think, maybe I should have just asked for the help, right? Avoid seeing problems as something that cannot be overcome. When we really begin to feel burnt out, stressed, you know, total stressed out, we begin to see problems and we just, our problem solving ability lessens and decreases, and we just see things as unsurmountable, right? So we really have to really avoid seeing problems as something that we can't overcome. And that includes looking for the potential growth or positive change at the end of a struggle as well. I'll send this PowerPoint to Holly so that you all can have copies of it. She's taking pictures on her phone. I'm like, I'll send it so that you can have it. Accept that change is a normal part of life. Change is a normal part of life. We may not always be comfortable with how things change or why they change or when they change, but we can focus on those things that we can control in the midst of that change. Sometimes if we feel like I'm just stuck in the same situation, nothing's going to change. But if we're able to focus on our goals and make some small steps to the goals, we see the future perspective and we don't get just totally overwhelmed in the day-to-day. Look for growth opportunities, right? What are some ways professionally I want to grow? What are some ways maybe in my personal life where there may be some need for growth? Struggles can make us stronger if we reflect on what happened and what we learned about ourselves. And we can oftentimes find, hey, I handled some pretty major stuff before and I can do it again. Oftentimes when we're working with our clients, we remind them, you know, think of a situation when it was bad and you made it through. What helped you get through that, right? And so look at the growth opportunities that you've gained from dealing with some of the storms and occupational hazards that you've dealt with. Nurture a positive view of yourself. How many times we are so down on ourselves? We don't have to let anybody else tear us down because too often we're tearing ourselves down. I can't believe I did that. I was late turning that in again. I just can't do this. They're talking about this new AI technology. Okay, so I'm going to share again in developing this presentation. So I've been doing presentations for a while and I take all the time, you know, I want to get the little different, I want it to look nice, right? And so someone came, we're working with Lakeland Community College, and they had come and did a presentation with us one day, and they told us about these AI tools. And I'm so resistant, because I'm so resistant. I'm like, no, AI is going to take over the world. We're not going to have a job, And so I'm doing these presentations because I got like 5 presentations I got to put together, and I'm stressed out. I'm like, well, let me just try it. Oh my gosh, it saved my life. We have to celebrate every win that we get, right? So nurture a positive. I don't know why that went to that, but anyway. I always viewed it as I'm not very good with this AI stuff, right? Or this isn't my thing. But when it's like, okay, I can try it. When you do that, you find the potential. I can build new skills. I can learn things. I can do things differently that can make my job easier. I don't have to be resistant to that. Keep things in perspective. Even terrible situations will eventually end. And no matter how overwhelming something is, generally it's not the end of the world. So again, helping to keep things in perspective. And hope, right? Aren't we in the field of hope giving? So many of the people that we work with feel hopeless. They've lost hope. So we need to really maintain hope. Find ways to remind yourself of the possibilities for the future, right? Generally, no feeling lasts forever. No emotion lasts forever, right? So really, no situation generally lasts forever either. So even if it's a difficult situation, maintaining hope for the future, the possibilities for the future. Because when we do that, that helps us plan for the future. That helps us to work on some of the goals that we talked about. So those are really important factors. Can someone read that for me? That first line, just the first 4 words. Just say it out loud.
Take care of yourself.
All right, say it one more time, just like you said it.
Take care of yourself.
Okay, there we go. Take care of yourself, right? Make sure you are taking care of your basic needs. How many times we're at work, we don't even take time to eat lunch? Right? But then you want to keep working and working and giving and giving and giving, and you sitting there, your stomach hungry, you hangry. So just little stuff, right? The same things that we tell people when they deal with a traumatic situation. We really it's important for you to take care of your basic needs, because the first thing we let go when we're dealing with trauma is our basic needs, right? Someone dies and then you're not eating, you're not drinking, but everybody's coming over with food, encouraging you to eat, encouraging you to do those things, because it's important, because you can't deal with anything else if your basic needs aren't met. So take care of yourself. Make sure you're doing the basic needs: physical, exercise, emotional, spiritual, professional, all of those needs. Make sure you're taking care of those. Find activities or places that help you feel relaxed and recharged. So if you like the outdoors, take some time to spend some time in the outdoors, finding those things that help you relax. Try new things, be creative, do things that make you feel competent. So when I use that it made me feel competent, because I'm like, I'm gonna take this presentation and they're gonna look like, oh, that looks so nice and professional, right? That helped to build my confidence. Even though I just put the information in there and poof, it happened. So anyway, remember, everyone's journey to resiliency or resilience looks different, and that's okay, right? That's okay. So what one person does to be resilient may look very different than what I need to do to be resilient, but that's okay, because that's our personal journey, right? And don't feel like I have to mirror or mimic everything that person did, right? Like, oh, they got through this and they did these things and they said this worked for them. They said, running really changed their life. So I'm going to get up and I'm going to start training for a marathon.
0.0, that'd be the sticker on my car.
Right. So that may work for them. That may not be your journey. Make your journey personal. Make it, specific to you. And practice. We don't learn these things. We have to practice, right? We have to practice taking care of ourselves. We have to remind ourselves to take care of ourselves. We have to practice all of these tips that we talked about today. For many people, using our own resources and some of the kind of strategies that we talked about, it may be enough to help build resilience. But for some, we may be stuck, right? And it may be difficult making progress. And so that's when we really need to determine, is this something I can deal with on my own? Is this something that if I begin to work on building my resilience, building my internal and external resources, I start doing all these things, I can bounce back. I can begin to restore, my resources so that I can deal with, continue dealing with life. But some people get stuck. And it's okay, even for us in the helping profession, to acknowledge when we get stuck. Oftentimes we want to encourage other people to get help when they need it, but we're willing or obstinate to get the help ourselves. So be sure to ask for help, because none of us are in this alone. And that is my presentation. Any thoughts, comments, questions, feedback?
Very good, thank you.
Thank you, Amy. Thank you. You are welcome. And I said too, I did a mental health first aid training here sometime last year. And Anne from our organization, she's like, I just love training over there. I said, I do too. Because sometimes you go somewhere and you do a training and people are there, they're just there, they're like, okay. Not participating, I said, but they're always so open to share, to learn, and you can just tell everyone's heart is in the right place. And that does a lot when you feel like, you've really contributed to you all continuing the work that you do. I do value the work that everyone in hospice does. When my mother-in-law was at the end of her life, we were able to have her in our home because of hospice care, because of the hospice social workers that came out, because of, the pastors through hospice who came out, all of those people, the nurses, everyone coming to our home allowed her transition to be one that was peaceful and where her family was surrounded by her. So I appreciate everything that you do.